Hello friends, hope you are all keeping safe and taking adequate precautions against COVID infection. September is the month for PAD, and today we will speak about peripheral vascular disease or peripheral arterial disease. Now this is basically a diagram of the circulatory system. What you are seeing in red are the arteries which carry blood from the heart to various tissues and organs, and the ones in blue are veins which carry the blood back to the heart. The blood from the heart then goes to the lungs to get oxygenated and then comes back to the heart to be pumped back into the body. The arteries are very unique. When we exercise, they can supply blood up to 20 times the baseline by dilating. As you can see, this is the normal artery at rest, and this is the artery which dilates on exercise. Now, these arteries can get diseased. They can be blocked suddenly. And when there is a sudden block due to a blood clot, it is an emergency. And patients can present like this. It's severe pain, total paralysis, or change in the sensation. And patients are unable to move their legs. And this is a vascular emergency. What we see on angiogram, we can see a blood clot here in the artery. Now we are seeing this very frequently as complications of COVID-19 infection. And one more reason why you need to be sure that you keep yourself safe from COVID infection. Now, what we are going to focus on today is chronic ischemia, that is gradually developing blocks in the arteries. Now, this you see is a normal artery, a normal human. And here you see a cholesterol plaque has started developing and it has increased. And here it is almost blocking the artery completely. Now, when a patient has a block in the artery which supplies blood to the leg, when that person walks, that person will develop pain in the calf because the arteries cannot dilate to increase the blood flow which is required during exercise. So they get pain in the calf or the thigh or in the buttock depending on the level of occlusion. This is called claudication. Claudication is named after the Roman Emperor Claudius, who used to limp while walking. Most patients with claudication will be treated with medication, lifestyle modification, risk factor modification, and exercise. Very few would require any procedure. When the disease is more severe, we see patients with what we call blue toe syndrome or frank gangrene and ulcer formation, or at times with rest pain. So these are the patients who are going to require further investigations and some sort of treatment to improve blood flow to the legs. Now, before we move on to evaluation and treatment, we need to understand what causes peripheral arterial disease. While genetics are important, the most important risk factor is smoking or tobacco use in any form. Whether one chews tobacco or smokes, it is harmful. The second most important risk factor is diabetes. And if diabetes is uncontrolled, it becomes a very, very significant risk factor. Increasing age is a risk factor. Other than that, hypertension and increased cholesterol. So all these need to be taken care of when we treat patients with peripheral arterial disease. When a patient comes to me in the clinic, how do I evaluate the patient? I do a clinical examination. I look at the health of the feet. Are they healthy? Is there any ulcer, any gangrene, any cracks on the feet which need to be taken care of? I check the pulses. And if pulses are good, it tells me that the blood flow to the feet is good. And I need not worry about peripheral arterial disease. If I'm not able to feel the pulses, I use a machine called a handheld Doppler, which is able to give me the pulse by sound or waveforms and allows me to assess how much the reduction in the flow is. And if the flow reduction is significant, we go in for an angiography, quite often an MR angiography, to see where the blocks in the arteries are and to plan definitive treatment. When it comes to treating, as I mentioned earlier, it is very important to take care of the risk factors. Medication is a very important part, controlling diabetes, stopping smoking altogether, controlling hypertension, controlling your lipids or cholesterol, and some medication which improves walking distance. Other than that, exercise and weight reduction is extremely important in managing patients with peripheral vascular disease. Now, patients who have severe vascular disease and do require some sort of intervention, we have a variety of procedures to choose from, depending on the patient profile and the profile of his disease. The simplest procedure that we do is called balloon angioplasty. So here you see the artery is partly blocked with a cholesterol plaque, and we thread a balloon over a wire through a small tiny hole in the skin and inflate the balloon and open up the artery. The cholesterol plaque is pressed against the walls and the lumen increases. Sometimes the lumen tends to collapse or is very irregular. Then we place a stent, which is a wire mesh-like thing, to keep the artery wide open. In patients or the arteries which are not suitable for angioplasty or any sort of percutaneous intervention, we go in for open surgery in the form of a bypass. So here you see the artery is blocked, and here we have done a bypass using a vein graft. So we bypass the block using a graft. Similarly, larger arteries can be bypassed using a synthetic graft. And the long-term results of these procedures are good. And even better if we take care of risk factors, that is stop smoking and control our diabetes and cholesterol and continue with regular medication. Now, we all know that prevention is better than cure. As grandma always tells us, a stitch in time saves 9. Say no to tobacco. Never ever smoke. Exercise, reduce weight, and bring your weight to normal acceptable levels. Control diabetes well. Take care of your feet. Control your cholesterol, control blood pressure. Most important, a healthy lifestyle in the form of a healthy diet. You are what you eat. So make sure that you eat healthy, use whole grain, fresh vegetables, fresh fruits, take adequate protein, and minimize intake of saturated fats and avoid trans fats altogether. Avoid refined sugars and refined carbohydrates. If you take care of these, by and large, you will have a healthy vascular system. So keep walking, keep smiling, take care, maintain distance, use masks, be safe. Bye-bye.